on the restructuring and transformation of economy, technoscience, and environment. Keane has co-edited a book, The Rise and Fall of Neoliberalism, The Collapse of an Economic Order, published by JP. Keane is an associate editor with Science as Culture. Keane, please.
Okay, thank you very much, Prasanna. So thank you, Margaret and Prasanna, for the invitation to come and talk. I also want to, maybe unusually, thank one of my tenure and promotion reviewers, who is the inspiration for this concept of rentiership. So that's another thank you. I don't know who they are, so I can't.
We're all in this room.
Sorry?
They're all in this room.
If they are, yeah, great. Caveats. This is rough. So this is a kind of, I'm working through these ideas around this idea of rentiership. It's also not about stem cells, so it might be not as relevant to people's work as some of the other papers. It's a broader kind of conceptual paper about the bioeconomy. Biomedical platforms is also not necessarily my kind of theoretical starting point. I understand them as being about the way that we arrange things. That's a broad kind of way I understand. So my aim in this paper, in some ways, is to think through this concept of rentiership in bioeconomy by thinking about biomedical platforms, bionetworking, in sort of political economic terms. So just to give you a brief kind of overview of what I'm going to talk about, I'm going to do a quick introduction, talk about some of the existing work, existing literature on bioeconomy, how it's conceptualized, then talk about rentiership as a concept, and then try and offer some empirical vignettes from my previous or current research. So there are a lot of concepts out there that try and integrate together the relationship between the life sciences and capitalism. So a lot of bio concepts called. And there's a lot of assumptions underpinning these bio concepts. So the concepts like bio-value, bio-capital, life surplus, clinical label, all these sorts of concepts. And so I think they're problematic. I've written about this. You can go away and look at these if you want. And so I think there's an important need to conceptualize the bioeconomy in different ways. And so engaging with things like platforms, bionetworking, and so on is a useful way of doing this. And as I said, the aim of this paper is to work through this notion of rentiership. So what I think is important is, and the reason I think it's important to conceptualize the bioeconomy in different ways, I think it's important to look at the political economic actors involved in the life sciences and the bioeconomy, to look at how they understand the life sciences and understand value and so on in the life sciences, and also to look at the various practices, processes, and institutions that they shape and they are variously shaped by. Okay, so some of the current theories around the bioeconomy, as I mentioned, this notion of bio-value, bio-capital, life as surplus, and so on. They take as their starting point the notion that value is an ethical and a material. It's produced from ethics and from materiality. And it's based on notions of commodification and commodity. So just to give you a quote from Stefan Helmreich, when he's talking about his literature, he says it's premised on the notion, quote, that new life science commodities, therapeutic molecules, genome sequences, etc., require reinvigorated analysis of capitalist practices as well as the correlated kinds of citizen, corporate and scientific subjectivities that are materializing along with such activities. And a lot of this material, a lot of this existing literature, is kind of fetishizes the biological. So people like Catherine Walby, as an example, talks about biological fragments that can be leveraged biotechnically so that they become more prolific or useful. Now there are some problematic assumptions. I could go more into some of this literature, but with time constraints I won't. So there are some problems. The first being that at least within the non-stem cell area, as we've been discussing, there are a limited number of products. There are some, obviously, but there are a limited number of products. And actually within the life science sector itself, it wasn't profitable globally until 2007. So, we've had several decades of non-profit in the life science sector. My argument is generally that the life sciences aren't about commodification of commodities, they're really about assetization of assets, and I'll come back to that when I talk about rentiership. Also, I think that there's a misunderstanding of promise, hope, and expectations. how they generate value. These future visions generate value in the present. This is basically accounting. This is discounted capitalization. It's not new. And then there are various issues with their units of analysis. Okay, so that's to give you a kind of critique of the existing literature. This notion of rentiership, this concept of rentiership then, try and think through how capitalism is transforming, or has been transformed as the consequence of a series of processes and so on over the last few decades. The term itself, rentiership, comes from the notion of economic rents, and the notion of an economic rent is slightly different from our general, ordinary notion of a rent. So rent is the payment that we give for the use of something, an asset. An economic rent is bound up with epistemic notions from neoclassical economics about there being a price, a natural market price for something. And an economic rent then is the cost above that natural market price. So that's what a rent is. Okay. So I think rentiership is a useful concept when we talk about the bioeconomy because it opens up questions about what is being valued, how is it being valued, and how is that value being managed. So what time?
You just used 5 minutes.
Okay, oh that's good.
10 minutes to go.
Okay, that's good. Okay, rentiership then. Characterized by the following aspects. And I'm sorry this is kind of this is a list. I apologize, it's a list. So I have 9 aspects that I think characterize rentiership as this kind of representation of a transformation in capitalism. First of all, it's based on knowledge. So the importance of knowledge in capitalism. So there's a lot of literature about, in the autonomous Marxist tradition, about immaterial labor, cognitive capitalism, prosumerism, all these sorts of things. And so knowledge is the foundation or basis of this kind of notion of rentiership. And it's not knowledge as a thing, something we have in our head, it's knowledge as a social process. So we can think about it rather than knowledge, it can be knowing. And there are various kinds of ways of knowing things. So the intellectual, creative mode, techno-scientific mode of knowing, but there's also relational knowledge or knowing. There's also kind of decisional knowing, cultural knowing, and so on. And we can think of hope in there somewhere as being another form of knowing, knowing the future, or having an expectation of the future. But these sorts of knowledge, knowing, can be turned into property. And so they can. The second aspect of rentiership is this ownership of knowledge and the construction, in particular, of knowledge monopolies. And so the example, we can think of things like TRIPS, the trade-related aspects of intellectual property rights, being one example. But we can also think of from the bionetworking theory, the more kind of unregulated forms of ownership there. So the kind of trade secrets, that sort of thing. And this ownership helps to create an asset. It's not about creating a commodity, it's about creating an asset which enables the production monopoly rents rather than the promotion of competition around products. Hence, rentiership. Thirdly, rentiership is, as suggested, very founded on the process of assetization rather than commodification. So it's about the conversion of all sorts of knowledges into assets rather than the conversion or production of commodities. An asset can be defined, according to the international accounting standards, as, quote, a resource that is controlled by an entity as a result of past events, for example, purchase or self-creation, from which future economic benefits, so inflows of cash or other assets, are expected. There's a specific logic to assets that makes them distinct from commodities, and a specific logic that determines their value. And in particular, the key one is that an asset is, almost by definition, a singular kind of process or claim. So you can think of an asset as being something like the copyright for the Beatles' music. Only one person can own that copyright to the Beatles' music. So we have to start thinking about competition in this sense differently. So it's a much more winner-takes-all form of competition than commodity production. And what underpins assetization, and especially asset values, is not some sort of inherent quality of the assets itself. It's an interplay between political, economic tools and ideas. Hence, my platforms might be So it's about how things are valued, how value is managed, and so on. Fourthly, rentiership involves a form of temporality. So instead of realizing value immediately through the production and consumption of goods and products and so on, there's a delay to the realization of value. And this delay can keep on going. And it can actually, you don't actually need to produce a product or commodity at the end of it. And this value can be captured by different actors as you go down the line. I'll come back to this when I talk about some of the empirical stuff. So essentially, people who didn't contribute to the creative moment can capture value from the assets. Fifth, there's new forms of social organization. So this relates to Bioplatform's idea around cooperation. So the new forms of social organization, especially around business organizations, new kinds of business organizations. Sixth, rentiership involves a different kind of a specific kind of epistemology or epistemic claims. So not only do we have techno scientific, these kinds of more general epistemic claims, we also have to have more kind of narrative claims that help to support those techno scientific claims. So the narrative then ensures that the epistemic claims become performative. Seventh, rentiership is based upon diverse and distinct forms of regulatory regime, from property right, contract law, regulations, drugs, medical treatments, all those sorts of things. And these end up objectifying relations, these regulatory regimes. Okay. Eighth, infrastructures. They involve particular kinds of infrastructures, rentiership does, especially around property. So you have to have specific kinds of property rights and so on. Sorry, I'm going to rush through because otherwise I'm not going to run out of time. And ninth, the rentiership involves specific kinds of spatiality. It's an inherently geographical concept. It involves certain kind of scalar dynamics, local, global interactions, organizational boundedness. Okay, so how much time do we have?
Well, 3 minutes.
Okay, I will give you a couple of examples of what I'm trying to talk about and trying to get across. These are drawn from existing or current kind of research. So first I'll talk about regulations and regulatory regimes. So in previous research I did, published in 2010, about the kind of governance and knowledge knowledge exchange. I argued with my colleague that these kinds of knowledge exchange in the life sciences are underwritten by an objectification of social relationships, especially trust-based relationships. And this objectification happens through the appearance of companies to life science standards, particular kinds of standards, regulatory standards, and so on, and trust in those standards. So you have GLP, GCP, GMP, ISO standards, and so on. The adherence to these standards then generates this trust, these kinds of social relationships, objective relationships. And this objectification is iterative. So the kinds of regulatory work that are necessary in a life science company means that you have to adhere to these standards, but you also have to make sure that your suppliers adhere to the standards, and also the people you then sell on the knowledge to adhere to the standards. So you have this kind of iterative pressure. And overall, this objectification facilitates the kind of convergence internationally of regulation, of a global regulatory regime. Okay. So I will just skip to the idea of asset valuation and the management of value. So this is new work that I've been doing, thinking about how, if we can think of capitalism being transformed by, has been transformed from a commodity-based kind of system to a more asset-based one, how do we understand value? And so this requires a rethinking of valuation. And this involves thinking it's not about necessarily it's not about the inherent material qualities of the products and commodities. It's about, we need to study the firms, the investors, the ways that these political economic actors understand, account for, and manage value in their practices and in their knowledges. And it's really about, value here is really about the ownership of assets, as I should have emphasized. And the asset value is not really about market exchange, necessarily, because assets aren't necessarily exchanged. It's really about understanding how these political economic actors go about representing their capacities, the firm's capacities, and how they go about monetizing these assets, their capacities. And this involves thinking about value, instead of thinking about value in a simple realization. You have a market exchange, and that leads to the realization of value. Instead of having that kind of simple process, you've got to think about value as a kind of relay. One person, one political economic actor passing on the baton to another political economic actor, and so on, as they sell on their assets. And this entails a certain logic where you have to continuously rise in value of the asset as you pass on the baton to the next person down the line. Okay, so just to conclude. The notion of platforms, biomedical platforms, or political economic platforms, as I was trying to get across, entails, I think, a series of often, the way that I've been thinking about it, often contradictory kind of pressures driving within the arrangements of these things. So if you think about, for example, just basically, if we think about the notion of what's going to come out of the kind of techno-scientific creativity, is it going to be a useful product versus what's going to come out of the political economic side? Is it just going to be the value that gets realized or gets captured by various actors along the line? And there's a series of tensions that we need to deal with there. We need to think about that. Okay, so apologies if that was slightly all over the place. I'm not sure what it was. But it was, yeah, so these are new ideas that I'm trying to think through. Thank you.
Thank you very much. 2 minutes for any quick clarification.
Yeah, just a quick question. So you mentioned that the life science sector became profitable in 2007. And do you know which sector in particular made the field as a whole profitable? If it's like instruments providers or making money, or
I'm basing that on data from Nature Biotech. So I presume they're just talking about they're not talking about medical devices. They're just talking about the kind of classic biotech sector.
Okay, thank you, Kim.
Thank you.
I think both the panelists and my colleague Chunki, they have been doing wonderful work in time. Thank you for that. And next we have Luca Marelli. Luca is a PhD scholar at European School of Molecular Medicine and University of Milan, and a member of the research unit on STS at the European Institute of Oncology. His project aims at dissecting the epistemological and biopolitical reconfigurations of the IPS research field. Luca has studied philosophy at University of Milan and the Catholic University of Louvain. He was a visiting research fellow with STS program at Harvard University. Now,
okay. So thank you very much. A big thank you to the organizers for inviting me here today and for assembling this amazing platform in the last couple of days. So in my story, I want to start from the 8th of October 2012, when from their headquarters at the Karolinska Institute in Stockholm, the Nobel Assembly issued a press release announcing the award of the 2012 Nobel Prize in Physiology or Medicine to John Gurdon and Shinya Yamanaka, that you can see here during and after the ceremony, for the discovery that mature cells can be reprogrammed to become pluripotent. And this is 50 years, as we know, from after Gurdon's pioneering experiment on tadpoles, and only 6 years after Yamanaka's first derivation of murine-induced pluripotent stem cells, or IPS. And indeed, from that seminal experiment in 2006, the field of IPS has boomed, and to sum up the advancement, I want to juxtapose 3 snapshots. So it is news of 2 months ago, that a Japanese woman became the world's first recipient of autologous retinal pigment epithelium cells derived from iPS in a clinical trial for age-related macular degeneration, which is currently being performed in Japan. 3 weeks ago, at the New York Stem Cell Foundation annual conference in New York City, Harvard scientist Kevin Egan announced the official signing of a contract with JSK to conduct what is the first pilot clinical trial in a dish, which is aimed at partially replacing the human patient with in vitro cell lines to conduct testing for a new compound for ALS. And also it is news of a few months ago that even Nestlé has started using iPS to screen for healthy food, as they say, whatever this may be. Now, against this background, what I want to do today is present the first systematization of my ongoing fieldwork, so really your feedback would be really welcome. And I want to do the following things. So I want to look at the constitution of two of the major iPS research platforms in the United States, which are the New York Stem Cell Foundation and the Harvard Stem Cell Institute. And I want to look at them as moments of co-production of governance structures, reward and accountability mechanisms, and practices of standardization. And in particular, by focusing on the New York case study, I want to provide an empirical characterization of a model of science steering and governance which is becoming more and more prominent in the US, which is venture philanthropy. And in so doing, I would like to bring to the fore what I consider a second and more fundamental form of co-production by showing how the emergence of innovative platforms for iPS research is accompanied by a configuration of the boundaries of the polity which has jurisdiction over science policy, which is meant to empower a subpopulation of stakeholders in the steering of the biomedical enterprise. So I focus on these two platforms, which are the largest stem cell organization in the world, which is HSCI, and the largest stem cell group focused entirely on translation and scale-up, which is the NICEF, as I'm going to call it. And you see here some of the data of the two organizations, and why apparently they share what are similar commitments in the advancement of translational stem cell research. What I would like to show you today is how they actually take two very different paths, two very different approaches. So I start from NICEF, which started operations in New York City in 2005, when the restriction posed by the Bush administration to the federal funding of stem cell research de facto made individual states and private capital as the science policy leaders in stem cell research in the US. And in this context, Susan Solomon, that you can see in the picture, she's an attorney, a venture capitalist, a prominent healthcare advocate in New York City. She decided to set up a non-profit organization from scratches, constructed it as a safe haven lab, as they say, where federal politics would have been checked at the door and scientists would have been able to freely pursue promising lines of inquiries without really being affected by the fluctuations of the political cycle. And to this end, NICEF was insulated from the federal political environment programmatically and its founding mechanisms, which is basically the NIH, and relied entirely on private funding, so both from philanthropists, which is basically affluent people belonging to the New York City financial elite, and major patient advocacy foundations. And the goal was really to maintain what the CEO described to me as the independence and the integrity of the entrepreneurial regime. And furthermore, NICEF was imagined as a catalyst for translational research and biotech innovation, and in that sense it was charged with the task of providing new technologies and a new research model so as to accelerate cures for the major diseases of our time in order to bridge the valley of death that slows down the commercial uptake of academic research. And as we know, this is a major issue, debated issue in the biomedical research. Now, the point that I would like to highlight is really how unique within the US stem cell context, the mandate to bridge the two imperatives, so the political and the translational, was met at NICEF through the adoption of a venture philanthropy model, which arose during the 90s, during basically the new economy, and it borrowed concepts and practices from venture capital, and it became increasingly more relevant in the last decade. Now, where indeed the venture philanthropy most significantly departs from traditional models of philanthropic giving, so when you may give money to Oxfam, for example, is precisely in the more or less direct involvement of philanthropists through the adoption of an outcome-driven approach in the governance and steerings of the organization, which either implement or are aligned with the grantor's own theory of change. We could say the grantor's own socio-technical dimension. And so without really going into the detail of this model, which is not the point here, what I would like to highlight now is why this model is relevant for the New York Stem Cell Foundation. So first of all, the New York Stem Cell Foundation was imagined by its founders as a game changer, promoting a disruptive model of innovation, that is to say, a clean slate, a clear-cut rupture with established experimental practices and organizational arrangements in the field. And in play here was the recognition that a business-as-usual approach, both from the part of scientists and from pharma companies, was simply not working in delivering on what were the potentiality of stem cell technologies. And so a markedly different approach was needed. As the CEO explained to an interviewer, looking around, I realized that if we left it as business as usual, you know, the analogy that I like to use is Katrina, where everyone assumes that everybody else is bringing the ice and nobody brought the ice to all these poor people stuck in the dome. So this is how the stem cell field looks like for the CEO of the organization before NICEF involvement. And the way to implement this vision was to centralize agency and risk within the organization, constructing it, you could say, as a translational hub or incubator. And that means basically two things. So first of all, establishing within the organization itself those technical and experimental infrastructures, which are very much geared toward the applied translational dimension, that they deem that the field is currently lacking to fully harness the potentiality of stem cell technologies. And also, it meant engaging with high-risk, high-return projects, as they say, that would normally not receive funding or attention by the NIH or risk-averse pharma companies. And so in other words, basically mean constructing a system where you de-risk research in the organization, so to make its development attractive for commercial companies. And we'll see how they do this in a minute. Before, let's go to Harvard. So the establishment of HSCI followed what is a similar pattern to that of NICEF. So HSCI was created in spring 2004 out of, again, of private funds. So all the money which the institute has raised and managed come from private sources. And it was done in an effort to circumvent the Bush administration restrictions on human embryonic stem cell research funding. You know, as one of the people I interviewed put it in a nice way, capturing a mood in the field. To be honest, in large part, we all have to thank George Bush for our facilities. And the institute arose out of the conviction that Harvard had the resources, has the breadth, and frankly, has the responsibility to be taking up the slack the government is leaving. Also here was, I mean, this was meant as a political statement from the part of the scientific community in the US. Now, the organizational model which has been adopted by the Harvard Stem Cell Institute, however, contrasts markedly with that of NICEF. So, first of all, HSCI was conceived as a virtual research organization. They say a concept, not a place. And it was set up, this means that it was set up without its own lab or experimental infrastructure on the basis of what we could call a distributed innovation model. So in other words, the idea was to establish a collaborative network bridging different Harvard-affiliated institutions, from the research hospitals to the medical school, but also to the law school and the business school. And this was done really on the basis of the idea that the way to advance the field was not to revolutionize established experimental practices, but rather was to empower, by providing the missing connections and financial resources, what were research structures that were already in place. So in this way, being able to draw on an already existent but left idle set of resources, skills, and expertise. So basically, they were promoting a model of sustaining innovation, which is also visible in one key aspect, I would like to argue, and that is to say in their strong focus on basic research, whereby the road to the clinic is imagined here as passing by preliminary significant investment in basic science, if this category make any sense at all. So now, in the final minutes, what I want to do, I want to see how these differences are relevant for scientific practice. So I want to go into the micro dimension and look at how these differences are reflected and are being reinforced in the standardization practices and technologies which are being developed by the two organizations. And I want to look today at the standardization practices as they really represent a privileged site to look at for the deployment of normative agents. And so, at Harvard, the paradigmatic of their sustaining innovation approach was the adoption of a core facility model for what is the main laboratory infrastructure and standardization technologies, which is overseen directly by HSCI, which is the IPS core facility. So the core facility was established in 2008 to streamline the derivation and the distribution of IPS, and it grew to become what is probably at the moment the largest core facility in the US. And in 2011, it started adopting a fee-for-service model, both for its Harvard and non-Harvard customers, reprogramming a variety of cell types using a variety of technology. Now, there are three things in particular that I want to note about this model, which is really widespread in the US, the core facility model. So first of all, the core facility model is constructed under an altruistic service-oriented framework. That is to say, as a way to provide a service to the scientific community by taking the burden off individual researchers in performing what are considered routinary tasks, like IPS derivation, distribution, these kind of things. And in that sense, as the executive director of HSCI told me, the IPS core is conceived like in a sort of artisanal production mode, like an Italian shoe factory. And I wish them better luck than Italian shoe factories at the moment. And the aim here is really to provide what they say standardization on a customized basis. And that means basically two things. First of all, produce standards that can be integrated within external experimental practices. And also it means, crucially, to allow customer labs to retain agency in dictating the requirements and the ownership of cell lines. And for this reason, the core facility is constructed, is really risk adverse with regard to the adoption of new untested experimental practices. You know, this is what a director of actually a New York core facility told me. You know, what the strategy is to linger at the back and let those at the bleeding edge to let me know how it goes in developing new technologies. And in developing risky stuff, like the first US fully robotic system for the in parallel generation of hundreds of cell lines, which has been developed at NISAF, and it could be like, call it the cousin of the Kawasaki robot that we saw yesterday. And so NISAF really conceived the array as the crucial component of their translational effort. And the array was meant to serve like these three purposes. So first of all, generate thousands of cell lines that could be made available to the broad scientific community, so it's both IPS and differentiated cells. It was meant to scale up and validate lab protocols within industry-compatible standards. The idea is to establish the proof of principles that discoveries which are made in academic lab on a few IPS lines can be replicated, scaled up, and validated in a robust manner on hundreds of cell lines. As this is really seen by NISAF as the only way to really bridge the academic and the commercial research. And third, the array is meant to use, to make available this huge pool of cell lines to map genetic diversity and conduct screens for new compounds. And the way in which really they imagined the establishment of this technology was reflected in how they designed it. So first of all, the array literally embodies this conflation of agency and risk, which is a characteristic of the New York Stem Cell Foundation venture philanthropy model. As one PI at NISAF explained to me, the idea was, what else can we do that is so large that nobody else would be able to realize? And second, I think it's important to mention, the array was not meant was not constructed with interoperability in mind, so to be compatible with established experimental practices, but was rather meant to create new standards. And so I come here to the conclusion. A couple of points that were traced. So first of all, we've seen, I hope I've traced in a distinct way the establishment of these two platforms of IPS-based innovation, And this different dimension that I sketch out really sustain and reinforce each other into distinct processes of production that shape two very different models two regimes of innovation. Now, one point that I would like to highlight in the minutes that I don't have anymore, but I think it's important, is how the different imaginaries and institutional arrangements are reflected in the governance and steering structure which is being put in place. So at HSCI, the agenda setting prerogatives lay squarely within the scientist camp, whereas as NISAF, on the contrary, the venture philanthropy model entails a shifting of the decision-making process towards a privatized arena of wealthy philanthropists who become proxies for the broader scientific community and the public good in steering of IPS research. And so in conclusion, I would really to highlight how the constitution of innovative platforms like NISAF, which adopt a venture philanthropy model. Do you remember the independence and integrity of the entrepreneurial engine, as the CEO talked about, is at the same time dependent upon and reinforces what is a widespread trend in the US of privatization of social goods and privatization of science, as this March 2014 New York article points out. And indeed, the venture philanthropy model departs from established models of science steering and governance. So even in the new social contract, as Sheila Jasanoff called it, which was aimed at forming closer ties between academia and the industry, the scientific agenda, while exposed to the influence of private capital, was still, at least in principle, subject to public scrutiny and oriented towards the production of social goods, even though in a form of commercialized science. In the venture philanthropy model, on the contrary, the agenda-setting prerogatives are programmatically devolved to private philanthropists, who in times of austerity especially and reduced budgets, are able to play, as one of them put it, an outsized role in who withers and who grows. And with this final remark, I thank you very much for your attention.
Thank you very much, Luca. Very interesting paper. We can take any questions or clarification. Yes, Will.
Names.
Sorry?
These philanthropists, who were they?
So two of the major that finance NISAF are Stanley Druckenmiller, which financed actually a funding program that NISAF has in place to give money to researchers. And I think it's interesting because, especially, I'm Italian, so I think it's extremely interesting that Stanley Druckenmiller, and also here we are in the UK, is the guy who was the manager of Soros Fund when he, in Black Friday, I think it was 1992, he attacked, speculated against the lira and the pound. This is one of the major people. And generally speaking, in the board of directors of NISAF, there's the vice president of Goldman Sachs, there's a bunch of different people.
Margaret.
Do you believe in a free lunch?
Me?
Philanthropy.
Sorry?
The philanthropy.
What do you mean?
Well, you're saying this is venture philanthropy, and that's
So you're asking
just
me-
for the public good. What's in it for the investors? I think that's what
That's-
Roger was asking.
Okay, so this is, I think this is an interesting point which we will also discuss afterwards. So the idea here is not, and they are very clear first of all, there is a methodological problem that when doing the fieldwork, of course, people are not going, to reveal what their business plan is, and this is the very first problem. But I think that is not really gets to the point. The point of the issue is that in this case, these people are really not up for making profits. They may have, at the end of the day, also this idea in mind. But I think the crucial way in which we should understand private in this case is not private in the sense of go there to make money, but instead of creating a space which is secluded from public scrutiny. So these people have already made money, and so they are using this money. They leverage on this money that they already made to steer a research according to what are their preferences. I think this is a crucial difference with the respect.
Thank you, Luca. I think we have a question here, but can you please keep it towards the end? Thank you.
Thanks.